name's Dr. Omer. I'm an electrophysiologist just outside of Charlotte, North Carolina, and I wanted to just tell you a little bit about our SiteSeal experience here at the hospital where we do electrophysiology work. SiteSeal's been a major difference for our program here for several reasons. One of the biggest ones is our ability to get patients in and out of the rooms a lot faster now. We don't have to hold pressure after each case, so we can apply the SiteSeal device to both groins on cases where we have bilateral access and get the patients off the table much quicker. So with the SiteSeal device, we can cover multiple access sites and enable us to move on to the next patient much quicker. One of the things that we've also really been able to appreciate are the patient experience is much better. For only 2 hours, they have to be at 30 degrees, and then the SiteSeal device comes off, and they can then begin to ambulate, which makes the patients much happier than laying flat for 6 hours. And the patients have done much better post-operatively with much less bleeding issues or complications or bruisings than we experienced by just holding manual pressure. For this, it's a big game changer because we only need one device to cover each groin, and so when we're doing cases with just one site, we can actually cover 3 or 4 different access points with one SiteSeal device, and it makes a massive difference in patient care. The only other thing I would add to that is that when we place the SiteSeal device and after the patients come out of the room, they're much happier. And the staff are happier, everybody gets to have a much smoother experience, and the patients are frequently able to go home the same day because we're not having to keep them here lying flat for so long.
So, Dr. Shedd, does it make a difference for the patients to be able to elevate the head of the bed and no restriction to leg movement?
It makes a great difference because they can then eat and sit up. It's a much more comfortable thing, especially for people with back trouble who have trouble lying flat for long periods of time. And because they only have to do it for 2 hours, it's tolerable for everyone. So it's been a much better patient experience, especially for those who've experienced the old way we used to do this.
Well, thank you very much.
My pleasure.